Hello, everyone. My name is Annalie. I am from Alberta, Canada. Welcome back to Pathways to Care CNA Review Exam Lecture. In this video, I will continue to discuss on the role and responsibilities of the support worker. I'm doing Chapter 1, Part 3. Our textbook reference is the Canadian textbook for the support worker. So let's begin by answering few of the review questions. The question 1, choose the best answer. Which of the following is not a responsibility of the support worker? A, cleaning and sanitizing the equipment. B, checking the water temperature inside the client's room. C, assess the client's health status. D, organizing parlor games for the client. Question 2, choose the best answer. Patient is a term used to describe a person who is receiving care at A, seniors assisted living, B, a hospital, C, a private home, and D, a group home. Review question 3, true or false? The people supported can be grouped according to their health problems, needs, and ages. Review question 4. Choose the best answer. Which of the following is the correct definition of activities of daily living? A, to speak or act on behalf of another person. B, the complex skills needed to successfully live independently. C, self-care activities people perform daily to remain independent and to function in society. D, the ability to recognize, perceive, and have understanding of another person's emotions by seeing things from his or her viewpoint. If you know the answer, please write down in the chat box below or write down on the comment section below. Now let's continue with the healthcare team. The healthcare team is a group of people working together toward a common goal, and the goal is to provide quality care to the client, meet the client's physical, emotional, spiritual, and social needs. Now the healthcare team is composed of professionals coming from different discipline, and they come in with a variety of skills. The support worker is an important part of the healthcare team. They are part of the healthcare team. Now, there are two types of professionals. One is regulated and the other one is unregulated. A regulated professional forms an organization, is self-governing, and they call their organization as college. And the college sets the education, educational requirements, and the license requirements in order for a professional to be registered in the said college or in the said organization. Now, the college establishes the scope of practice. The scope of practice describes the activities, services, or procedures that a qualified health professional is competent to do. They also establish the code of ethics and standards of conduct for its members. Now, this sets the values or outlines the rules and behaviors towards the public, the client, the profession, and the professional himself. Now they have a legislation. The legislation details the roles and responsibilities of its members. An example of a college is the British Columbia College of Nursing Professionals, or the um, College of Nurses of Ontario, or the College of Physiotherapists of Manitoba, or the College of Licensed Practical Nurses in Alberta. Now, this is an example of how a healthcare team looks like. The client is in the middle, is in the center, and their goal is to provide quality care to the client. So the physician is involved, the nurse is involved. When there are some health issues that the nurse or the physician will observe on the client, they will contact the physiotherapist For instance, the client has some difficulty walking. Well, the physiotherapist can come in and assess and provide care, and the physiotherapist will communicate with the nurse, and the nurse will also come up with a care plan. Another example is if the client is having some issues with weight loss, maybe the nurse can communicate with a nutritionist. The nutritionist will assess the client and find out what causes the weight loss. The nutritionist can recommend uh, some kind of food or some beverage that will help with the client's nutrition and hydration, and communicate with the nurse, and then the nurse will also communicate it in the care plan, or they will formulate a care plan and also intervention for the client. Now, there are different nurses. We have the registered nurse, registered psychiatric nurse, the licensed practical nurse, and the support worker works under the supervision of the nurses. The second type of profession is the unregulated profession. They don't have a professional college. They don't have, some of them does not have official requirements for educational programs, while others follow the provincial or territorial educational standards. They don't have a code of ethics, but they must adhere to the codes of behavior as dictated by their employers. So one of those unregulated care providers are the support workers. They're also referred to as unregulated care providers. In some provinces, like Alberta in particular, they um, set up a registry or a directory for the healthcare aides, and it is approved. A new curriculum, the 2019 curriculum, was approved by the government, and all support workers who wants to practice to work as a healthcare aide has to register in the Alberta HCA directory. So the definition of scope of practice, according to your book on page 12, scope of practice set the limit and the extent of a healthcare's role as determined by the province educational standards and the employer's policies in order to protect clients from harm. So harm can come in many forms. It can be a physical harm, mental harm, or psychological harm. So people of the scope of practice in healthcare field varies from province to province as well, uh, and also from employer to employer. The scope of practice, one, outlines what can and what may not do in relation to client's care. The support worker should never act beyond the legal limits of their role and responsibilities. It is important that support workers should perform tasks that they are trained to do and to protect client from any harm or serious health problems that may arise. And they also expected to perform tasks or procedures within their role and responsibilities. And again, it is to protect the support worker and the employer from any serious legal problems in the future. Now, I have here example of roles or the limits of a support worker. These are some role and responsibilities and procedures that a support worker can perform, and the procedures or the limitation of the support worker. One procedure is to um, admin, med, administer medication, or I'm sorry, it's medication assistance and reminders. The support worker can do that. Emptying of ostomy bag or urinary bag, assist with feeding, application of compression stockings, remind patients or um, family members not to smoke around the patient area who is receiving oxygen therapy, check vital signs on stable patient only, assist with shower, assist with toileting, do pericare and hygiene, simple wound dressing, oral care, provide recreational activities, and transfer clients or transfer patient using transfer device. So what are the limitation? What the role limits. So what the support worker cannot do. Number one, they cannot administer PRN medications. It should be the nurses who will administer PRN. Um, they should not insert tubes or objects inside the body of the patient. They are not um, supposed to change the patient's diet or food consistencies. They are not to initiate or terminate an IV therapy. They are not to initiate oxygen therapy. They are not to administer injection. They are not to take orders from the physician. They are not also to disclose diagnoses of or laboratory results to patients. They should not revise. They are not to revise or alter a care plan. They are not to initiate assessment on the client. They are not also to move the client after a fall or to assess a patient after a fall. So these are just example. There are still other role and responsibilities and that a support worker can do. So these are examples also of the limits, the things that the procedures that the support worker cannot do. So where can the support worker find information about the sources of their scope of practice? One is the Provincial or Territorial Educational Standard of Practice. You can find that in the website of your province. The school where you get your training, like this review we're doing right now, you can also get information from here. This is a very good resource for information. Next is the employer's policies and procedure, because the employer will outline all the step-by-step protocol of procedure that a support worker can do. The third source of information of scope of practice will be your supervisor. Your supervisor will be able to determine, they will be able to assess whether you're competent or you're prepared to do a particular task. They will determine whether this task or this procedure is necessary, and they will determine if you have the right educational training and skills to perform this task. Now, who supervises the support workers? So the registered nurses, the LPNs and RPNs are the professionals who supervise the support worker. The RN manages the health status of the general health status of the client or of the patient. They do assessment, they formulate nursing care plans, they develop care plans, they implement and evaluate nursing care. They also carry out physician's orders. The LPNs also do the same. Um, in some facility setting or in some work setting, the RN function as the director of care or director of nursing or care manager or education manager or clinical lead manager. In some settings, the LPNs also function as director of care, client care manager, or education care manager. Now, the support worker works under the supervision of the RN as well as the LPN. And also the allied healthcare providers works under the provision of the RN and the LPN sometimes. So in the hospital and facility setting, the RN and the LPNs are the supervisor of those support workers. In the community, the RNs, the LPN, or the social worker are the supervisors of the support worker, depending on the setting, depending on the type of service or the type of assistance you provide in the community. When the support worker works for a private home or in a private home setting, the client or the family member will supervise the support worker. So it is very important that a support worker must be aware of the provincial or territorial legislation that limits the tasks and procedures that they can perform. So what is a true professional? What are the qualities of the true professional? You may have heard the term professionalism. So, professionalism is an approach to work that demonstrates respect for others, commitment, competence, and appropriate behavior. So being a professional means being cheerful, um, uh, sharing or spreading positive vibes in the workplace, being friendly, keeping work schedules, and performing tasks competently, as well as helping others. So let's check what are the qualities of a true professional. So, number one, a true professional has positive attitude. They're always enthusiastic. They have the energy when they start working. They're considerate. Um, they are courteous. They're honest and cooperative. They avoid slang terms and profane languages, and they do not gossip and complain in the workplace. The second quality of a professional is a sense of responsibility. When we say sense of responsibility, an example is when when you made a mistake at work. So the first thing you should do when making mistake at work, especially if it is a medication error, is to stop doing that procedure. Stop, admit your errors, and then report your errors. Do not cover up your error with another error. Accept constructive criticism. Learn from others the positive way, and do not blame others for your mistake. Always own your mistake. Another example is to keep a record of your schedule. Be punctual and finish your work on time. Um, Complete your task on time. Do not skip tasks. Do not try to choose the task that you're going to do. Make sure you complete all the tasks that are assigned to you. Next is personal appearance. Personal appearance is very important. Appropriate dressing is expected for a professional to wear while working in a facility or in a work setting. They should show respect to the people they care, um, and to their co-workers, and of course to their self. They should uh, avoid wearing excessive accessories, because if you have excessive accessories, these accessories might get caught on the client, and that will cause injury to the client or harm to the client. Next one is discretion about client information. So showing good judgment is about what to say or how to say it and when to say it and where to say it. So it is always important that you know who to disclose the information, especially if it is about the resident. Now, confidentiality is very important. We have to make sure we keep the clients or patients' information confidential. So, confidentiality is respecting or guarding the personal and private information about another person. Health information is very important and should be shared only to team members involved in the client's care. If your friend is working in the same facility but is not involved in the client's care, then we should not share the information of that person. We should not also share the information of the employer or the coworker. We should keep it private. We should not spread any information to anybody. Number one, a true professional has a lifelong learning. After you finish your program, after you take your provincial exam, you keep learning and keep yourself up to date to the new equipment, new techniques, new best practice information. And you can get this through webinars, through workshops, and in services. In services are the education service that the employer will provide to their employees, to their staff. Next one is advocating for the client. It is important, it is very important to communicate, report, and record or document any unusual observation about the client or about the family. Communicate with the healthcare team, because they will be able to help with the client. They will be able to come up with a different intervention, or they will be able to come up with a different approach in caring for the client. The next one is discretion about personal matters. We do not discuss our personal matters to the client. We do not discuss about our uh, coworkers' personal matters to the client. We always maintain a professional relationship to the client. We can be friendly, but not too friendly, not friends enough to disclose our personal matter. We have to keep it to ourselves. Last one is using acceptable speech and language. In Canada, we are bilingual. We have two languages, the English and the French. So if the community or the facility where you're working at has an official language, English as official language, then we have to use that language when communicating with our coworker. Never communicate with a fellow coworker who speaks your native language in front of another coworker or resident who does not understand your native language. So, that's very unprofessional. Avoid offending clients and coworkers. Never use foul, vulgar, or abusive language. Avoid using slang. Do not give new nicknames to the clients that they are not comfortable with. Be gentle and clear when talking to the client. Do not be abrupt in your approach. Do not fight or argue with clients and their family members, as well as to your coworkers. Now, what is a person-centered care? So we can improve the quality of life of our patient uh, through person-centered care approach, also known as the client-centered care or the compassionate care. So in this type of care, the focus is on the client. The approach of the care is on the client and his unique issues rather. The healthcare team encourages the client to actively participate in his care. We allow the client to give suggestion, to uh, do evaluation of our care, and to we want him to voice out the type of care that he is comfortable with. So the care team collaborate and advocate for the client in order to provide safe and effective care. So they make sure that each of them um, ensures that they uh, encourages the client to participate in his care. So this is an example of a person-centered care. One is we have to promote dignity and respect. So every person wants to be valued. We don't want to be ignored in a group of conversation. We want to be valued. So we also have to do this to our clients. Some clients are practicing their religious traditions or cultural traditions, and we have to respect this practice of the client. Each client is unique. We don't have the same care plan for two individuals. It's an individualized care according to their needs. We support independence. When the client is able to do some tasks by himself, we encourage that and we celebrate that. If the client is able to live independently at home, we also support that and encourage the client to live independently in his own home. We also honor the client's preferences, the type of clothes he wants to wear, the type of products he wants to use for his hygiene, the type of food that he wants to eat, and the type of recreational activities that he wants to get involved. We make sure that we preserve the client's privacy. We don't want to disclose any health information about the client. We don't want to expose any body parts of the client that is free of viewing by other people, by co-residents or people who are not involved in his care. We have to make sure we give them privacy by closing the door or by ensuring that the privacy curtain is there. Next is empowering the environment. It's always important. Safety is our number one priority. We want to make sure that the surroundings of the client is safe. The machines that is being used on the clients are functioning well. We have the right care plan. We make sure that the hallway is not a trip hazard, or the residence of the um, person is not a trip hazard. So principles of clients care. Remember the acronym DIPS, DIPPS. So number one is D for dignity. It is a state or of feeling worthy or valued. Next is I, independence, allowing clients to do what they want or what they can. Next is preferences, allowing clients to make choices. Next is privacy. Clients' bodies and affairs has to be kept private from viewing by other people. And next is safety, being free from hazards and feeling secure about the care provided. So when a support worker provides care or assist a client, they always have to remember that they have to use critical thinking prior to performing care or while performing care. So critical thinking is the ability to think clearly and logically using reflection and reason. This is based on the knowledge that the support worker obtained from her experience, from her education, and from her observation. So before performing a procedure, always think, is this the right procedure for the right client? Is this indicated in the care plan? Am I competent enough? Do I have the right training to perform this type of procedure? Is the patient or the client comfortable with this procedure? After the procedure, the support worker will do a reflective practice review. So a reflective practice review is a self-evaluation of care provided with the goal of identifying ways to improve clinical performance and care giving. Now, the support worker will make an evaluation of her performance. Did I do the right thing? Was the patient or the rest client comfortable with my performance, with the procedure that I've done? Was it helpful to the client? Did I miss any steps? Do I need more training on this? Or did I do the right observation? Did I improve the quality of life of the client when I provided this? So these are examples of reflective practice review. Now, critical thinking is very important when making decisions. It's also important when problem solving in the workplace or in the setting. So there are considerations that the support workers should follow. Number one, the goal of the support. It should always be person-centered care. So remember your DIPPS, the dignity, independence, privacy, preference, and the safety. The client's viewpoint. Did you include the client in your care? Did you get suggestions from the client? Was the client comfortable? Did it help the client? Uh, is the procedure relevant to the client? Next is the scope of practice. Scope of practice, um, uh, you have to consider whether you're allowed to do a certain procedure. Is it part of your training? Are you allowed to do this without the supervision of your supervisor? Or does the client need another professional to do this type of procedure? The last one is the supervisor's viewpoint. So the supervisor will will determine whether you are competent to do a certain procedure, whether the procedure is within your scope of practice, and whether the client needs this type of procedure. Now this ends chapter 1 and part 3 of chapter 1. Thank you very much for watching this video. I hope you will also watch the other videos that will discuss other chapters of the book.